Does my child need behavioral therapy? In next 2 minutes, I'm going to give you the clarity. And at the end, I will give you one simple practical tip that you can do at home right away. First of all, shouting, tantrums, all these behaviors are common in kids. That doesn't mean the child needs behavioral therapy. Behavioral therapy is usually suggested when the behavior is too intense, or it happens very frequently, or when it affects the school performance or daily routines. What actually happens in behavioral therapy? It is very practical. Behavioral therapy doesn't mean that we make the child sit and instruct what to do and what not to do. First, we try to understand the pattern. When is this behavior happening? For example, is it during the homework, or whenever you switch off the TV, or whenever they want something and it is not being provided? What happens just before it, and how are we adults respond to it? Once we understand the pattern, we work on two things. One, we teach the child a better way to handle the situation. If they scream during homework, then we teach them how to ask for help. Or if they melt down whenever the TV is off, then we teach them how to handle the transitions with warnings and routines. The second one is how we as adults respond to the behavior. Are we giving in too quickly, or are we responding so much to their negative behavior? Are we being very inconsistent with our rules? If we just change the way that we respond, most of the behavior settle down. Now, here is a simple thing that I promised. Children repeat the behavior that we notice more often. So, let's reinforce all the positive behaviors in them. For example, instead of shouting, they ask for help. So, encourage that behavior. That small reinforcement done consistently changes the behavior. Sometimes therapy is enough. Sometimes small changes in home make a huge difference. If you're unsure, a proper assessment can help you understand what's really happening, whether support is needed.